tonight, we are going to discuss about the contract issue of medical personnel, which has drawn the national attention lately. Young doctors under a government employment contract are being left out of a permanent position after their 2 years contract, which are not counting their 2 years housemanship.
Yeah, first, there are too many doctors, too many graduates who are joining the housemanship program. And secondly, the government has financial constraints to pay pension, which is a huge amount and getting bigger every year. The options after the contract are quite limited. The current system should be changed by increasing the benefits that are given to the permanent doctors. The 1 year contract extension may help temporarily, but I feel that we should give the same benefits to those contract doctors as permanent doctors. That means equal work, equal pay, equal benefits.
After they resign, two things I want to highlight here. So number one is actually leaving the country. So that there are better opportunities overseas. The second thing is the second option is the private practice. In medicine, we talk about skills, knowledge, and also experience. Knowledge you can learn by attending courses, but skills needs to be practiced. Experience needs to be gained, and this when they go out, into the private practice, they tend to have a little disadvantage here.
So actually, the contract system was introduced in 2016. We have not seen the first batch out yet, but the prediction is most of them will come out and open up GP clinics. Okay, the issue of contract doctors is paradoxical. Many doctors are fighting for limited permanent positions in government. On the other hand, there are not enough doctors serving the underfunded and overstretched public healthcare system.
Maybe we should consider to let all big private hospitals train specialists, and maybe we should set up examination boards like America for different specialties in the future. At the same time, these contract doctors can leave the government service and join private hospitals and being a trainee for a special program. We need a hybrid system whereupon government or private hospitals also train specialists like other countries.
Dr. Raj, what Ke mentioned, workable on this one?
Yeah, I think because the pharmacists are already doing it, where they call it liberalization, where pharmacists, junior pharmacists who come out from the college, they are accepted in even private hospitals and other private institutions to do their housemanship. So it's not like doctors. Doctors, we have to go to a public government hospital so that our housemanship is recognized.
We are talking about doctors working in KKM, Ministry of Health, who have to actually leave their post for a few years, for 4 years minimum, just to join the university, carry out their studies. To facilitate that, they require this thing called Hadiah Latihan Persekutuan, which allows them 4 years of leave to go into MOHE, Ministry of Higher Education. So this where the issue is because for HLP is only available for permanent doctors, and that's the major issue for the contract doctors. It's an amount of money, not everybody can afford it. So we need to look at how we can subsidize or help in terms of making income tax deductible or exemptable for this thing.
For better result, you need the collaboration of MOHE, you need the collaboration of Ministry of Finance, we need the collaboration of JPA.
In general, in the short term, we need to provide longer contracts, extension to these to people who are currently on contracts. But this kind of extension must come with fair contracts as well.
Parti Keratang will continue to be the bridge between the government and the contract doctors. Government has improved the benefits, improved the salaries. I suggest we need to bring in the private sector, private hospitals, especially big ones, to collaborate with the government to train more specialists. Thank you.